So today we're looking at our third lesson in the first section of the anatomy course, and we are looking at orientation and directional terms. And again, these are things that we'll use throughout the entire anatomy course. The terms superior and inferior you will hear when a doctor is talking about a break or how they're going to make an incision, and that is easy to understand if you just think of superior is anything to the head. So your head is superior to the rest of the body. So if you take a look at the example from the Marieb 1C, and that's in Google Classroom, that is the PowerPoints that go with your textbook. Marieb 1C is the orientation and directional terms in planes of the body. They give an example of the forehead is superior to the nose. Another one would be that your navel or your belly button would be superior to your kneecap. And then you have another example of inferior. They talk about caudal, and caudal is generally not used in anatomy. You will find that referred to if you were doing an animal science class, and caudal has to do with from the tail. So usually only when we're talking about gross anatomy or the human body, we'll only use the two terms for your large direction is superior and inferior. And then your front and back, and from this point onward, please don't say the front of your body or the back of your body. I was still correct in case studies in May of last year that were referring to where the thymus was located or where the kidney was located, and people were using the back of the body or they were using the front of the body. And those always were marked wrong because you were supposed to be using anterior for the front of the body and posterior for the back. And it's probably good at this point to talk about anatomical position of the body. They talk about it from how a body would be positioned if a medical examiner was looking at that body. So the body is actually laid out on the table and the palms are up. So if I can stand, the palms of my body would be up and my feet are also up. And so that helps in just a minute when you understand why the top of the foot is called what it is. So again, superior, inferior, front is anterior, back is posterior. The other term for posterior is dorsal. And although you will hear the term dorsal fin in animal science again for example, a fish or a shark, etc., the dorsal is also used at times in the anatomy as well, especially when it comes to the foot. And so I would practice these at home. I would take either the action figure that from a younger sibling or that you might still have hung onto on a shelf, or the doll, or whatever else might be around. Go back to your apple person or your pickle person and practice that. If I ask you a question as far as the mouth is what to the top of the head, what you're looking for is the mouth is inferior and the head is superior. And if I asked if the sternum, or what you have known probably is the breastbone, is the sternum anterior or posterior, and it would be anterior. The next slide talks about, let me move it down just one, medial, lateral, intermediate, and proximal. And in this, I will tell you that we do not usually use the intermediate in our introductory anatomy class. It will be medial, lateral, and proximal. Those are the three orientations that we'll be using. So medial, again, we've already used in the planes of the body. Remember that the sagittal plane is also known as the midline or median, and so that is to the middle. And so that one should be easier for you. The heart is medial to the arm is what Marieb 1C, the PowerPoint in Google Classroom, uses as an example. I would also say, even if you're looking at just the leg and we're looking at different muscle groups, one would be medial to the others. Lateral is the opposite direction. It's away from that middle. So here we have the sagittal, and the lateral is going away from that to the outer areas of the body. So the arms are lateral to the abdominal cavity or the chest cavity. We're ignoring intermediate. That will not be on your test. And now we're going to proximal, and notice what you see on your screen. And again, I'll make a note in Google Classroom when I put this Screencastify in there to please make a note that the text skips on their PowerPoints proximal and distal. They have proximal, but they do not have distal, and distal will be on your test. So proximal is closer to the origin of the body, any place that you're looking at. So if I have in reference to the heart or the trunk of the body, so if I'm looking at the arm, my fingers are not as close to the heart as the top of my shoulder is, or at the top of my bone called the humerus that we'll go over in just a minute. So the humerus, or the top of my arm bone, is proximal to my heart. So again, fingers are furthest away. The top of my humerus would be proximal to my heart. Now we'll go the opposite, the distal, the piece that the PowerPoint doesn't discuss. Distal is the furthest away. So in this case, if I raise my arm, my fingertips are distal to the head of my upper arm bone of my humerus, and my humerus is proximal to my heart. And again, you can take any part of the body and do that. So they give the example again in the PowerPoints, and they're talking about the lower arm bone, and they talk about the wrist being distal and the elbow being proximal to the upper arm. If I continue on with the PowerPoints, anterior and posterior, all they're showing here, please ignore for what you are learning or going to need for your first test. You will not be asked any of the material that's on this slide. Eventually we will know almost all of it, but this is just to show you the anterior part of the body compared to the posterior part of the body. That's all that would be expected of that slide. This is the body planes, which is review, and let's just take one more moment to review that, please. So again, they are showing you the midline, also called the median, or the mid-sagittal. Remember that we also have a parasagittal that's the outside and a median sagittal towards the middle. Then we have that frontal or coronal plane, and then the transverse plane, which is going across the middle. And I made a note in the first Screencastify in your Google Classroom that I do mention as I was replaying the Screencastify. I'd say that the example would be the magician sawing the person in half, and that is an example of the transverse plane. But again, in the Screencastify, I mentioned that, and I just wanted to make sure that you understand that the surgeon would not be cutting the person in half. The surgeon might be taking a section sideways off on the posterior part of the person's thoracic cavity, where the abdominal thoracic cavity, where the kidney is located, but not sawing them all the way in half. And here is the cavities of the body. The cranial cavity is where your brain sits. So this is called your cranium. That includes all of the bones of your top half of your skull, your cranial cap. And there are quite a few bones there, and we're going to end up learning all of them, but that's the cranial cavity. The thoracic cavity is the chest area, right up to the diaphragm. And I'm standing and showing you my diaphragm is right at that bottom of my rib cage. And the diaphragm is a muscle that's pretty critical. We can't breathe without it. If it is punctured, it is not able to work. It's a muscle. And what it does is that when you inhale, it causes lungs to expand, and exhale, it's pushing out. And that's all the work is done by that diaphragm. And again, if something goes wrong with the diaphragm, you simply can't breathe. The thoracic surgeon would be the surgeon that's responsible for anything of that chest cavity. Now, I say that in general because for an emergency surgeon, they would be able to do any of that thoracic work. But if it's a planned surgery and it's on the cardiac system, it would be a cardiac surgeon. And there's even specialists beyond that, people that only put in valves or surgeons that only work on bypass, etc. So again, cranial cavity, thoracic cavity is where your ribs are. Then you have the abdominal cavity, and that is where you think of as far as your intestines are. Your pelvic cavity, if you put your hands on your hips, the hips are the top part of your pelvic girdle. And that, if you wrap your fingers around that, that's the pelvic cavity. So before we continue, cranial, thoracic, abdominal, pelvic, and our final is our spinal cavity. And the spinal cavity is, you just think of it being just a spine, but there's actually quite a bit that goes on in that area. There's spinal fluid. It is clear, or it should be clear, unless there's a bleed or a massive infection, and then if it was an infection, it would turn a yellowish color. If there was a bleed, you would see a reddish color. I tell students that we go through a minor first aid section. If you come upon a crime scene, many of our students go on to become EMTs or that paramedic type professional, depending on what state they're in. And the word of the rule is, if you have many victims and one of them has clear fluid coming out of their ears, you bypass them, because that means that they've had a enormous trauma to their spinal cavity and to their cranial cavity, and that is spinal fluid that is leaking out of their body. So again, you're going to need those, all of those cavities for your test. If I move onward, your abdominopelvic quadrants, and these again we'll use quite a bit because you're talking about where things are located. So on your apple person, make sure that you are thinking of it as if you're looking at the front of the apple person and their eyes are in front, it is the right quadrant, left quadrant to that apple, your right and left lower quadrants. For example, I had a student that was rather problematic quite a few years ago. I was working at a prep school, and the child, for every test, was always ill and had some sort of massive disorder and had to go see the nurse into the emergency room. And so they were complaining of severe pain and they described it, they showed me with their hands, the left upper quadrant of their abdominopelvic area. And they said they had an appendicitis just a few weeks ago, and they're sure they had to go back to the emergency room. And so that's when I informed them that they should pay attention more, because the appendix is in the right lower quadrant. The little girl ended up taking her test, not doing particularly well, but she did take the test. And this is our final piece that we're learning. And do ignore the right epigastric and the left area. You are not responsible for those. The left and right lumbar regions are for your spinal cord area. Umbilical is where your belly button is. The right iliac is the top right hip. The left iliac is the left hip. And your hypogastric region is where the end of your intestines finish up. So let's go over that again. Right, if you're looking at yourself, you can put your right hand on your right side above, right below your rib cage. That's your right lumbar region. Put your left hand just below your rib cage. That's your left lumbar region. The umbilical region is where your belly button is. Where you put your right hand on your hip is your right iliac region. Left hand on hip, left iliac region, and in between that, the middle region below the belly button, your hypogastric region. So we don't want to show all of this. Just going to take a moment or two to show you a couple bones. Although we'll do bones after we do what I call the integumentary system, or the skin, after we finish the planes of the body, there are 206 bones of the body. So I like to show them a few at a time during lessons, and so that you just learn a couple each week. So this is the top of the femur. The femur is the upper leg bone. Our upper leg only has one bone, and it has this nice sturdy head on it. If I turn it sideways, it takes up almost the entire screen. And so this would be an adult male femur. And again, our body has one upper leg bone. This is the clavicle. It is S-shaped, and the clavicle is actually your collarbone, and it is one of the easier bones to break. I'm trying to get that into position, but watching the screen and this is pretty hard. And so a lot of you, when you were doing a jam, when you were playing, you might have hit that and broken your clavicle. So those are the first two bones that we learn, femur and clavicle. Thank you.